We really appreciate the opportunity to talk today. And I know it'll be shocking, but probably the biggest challenge in healthcare is dealing with dysfunctional leaders. For the most part, we all know what we're doing, and if we were allowed to do it, we would be successful. But importantly, in the majority of times, there's somebody above us, whether we're CNE or even the president of the hospital. There's always a board, and there's always dysfunctional leadership on the board. So what we hope to talk about is to give you some examples of dysfunctional leadership, more importantly, strategies to address dysfunctional behavior, and the importance of taking care of yourself, taking care of others, and then I think what would be helpful is if we're going through this, you can try to think through a dysfunctional leader or person that you're dealing with now, and hopefully what we're going to talk about will give you some ideas or insight into how to deal with them. So how many people in this audience have ever had to work in a situation where you were dealing with a dysfunctional leader? Well, yeah, everybody. And how many of you would say you were successful in how you dealt with them? Pretty rare. I agree. And I think part of the issue is that that the major takeaway about this is it's really difficult to change an adult, and particularly an adult that's in leadership and feels empowered. So one of the things we have to do is we have to learn some coping strategies, but don't expect to change. And Cindy and I are good friends and have known each other for a very long time, but I think personally where I became closest to Cindy is when I was in a situation dealing with a dysfunctional leader and having somebody who really understood where I was, who I could relate my feelings with. And as shocking as it is, simultaneously, Cindy was in a similar situation, and in spite of the fact that we were adults and mature and in really long-standing good relationships, it's important to have somebody there. So the major thing to do is to really actively listen. So when somebody is bullying you or indifferent, the tendency is to argue and to sort of talk with them. But what you really want to do is just listen and play back to them what they're saying, and we'll give you some examples. And to focus on the real stuff. When you're dealing with a dysfunctional leader who yells and is belittling, and doesn't appreciate where you're at, the tendency is to focus on their behaviors, but what you really want to do is try to ignore it and get them to focus on the issue. And 95.9% of the time, fighting back or arguing with a dysfunctional person only accelerates and explodes the dysfunction. So what you really need to do is have the emotional fortitude not to fight back, build a support mechanism, and then more importantly, when you're dealing in a stressful situation, and dysfunctional leaders, it's not just one argument. It's a long period of time where you're trying to cope with this abusive behavior. It is a time to self-reflect. And are there things that I have done that have inflamed the situation, and how I can sort of avoid that? And then, more importantly, how you take care of yourself. So, we're, in the interest of time, we're only going to go over bullying, but if you're interested in some of these other dysfunctional leadership issues, autocrats, people who just don't want anyone else's opinion but their own, narcissists, leaders that only care about how every action has to make them look good, and more importantly, a narcissist, if something goes wrong, if there's a union election or if there is a medical error, it's never their fault. It's always somebody else's. And physicians in particular have a lot of these characteristics. And unfortunately, in today's healthcare world, there's still a hierarchy in many organizations, and physicians never make a mistake. I mean, the God syndrome still exists in America, and it's always the nurse that was taking care of that patient that caused the problem, which is just total BS. And more importantly, the non-communicators, there's nothing harder than working with a leader who doesn't talk to you about what they expect, or more importantly, doesn't give you feedback. So I'm going to talk a little bit about bullying behavior. And I was at a very prestigious hospital last week, and was attending a medical executive committee meeting. So all the department chairs of the various departments in the hospital, and the CNE is there, and the president of the medical staff, the chairman of the medical executive committee is an oncologist. And he started the meeting unprovoked, attacking the CNE. I can't believe you're here. It's because of you that the quality of care at this institution has declined. And you're the reason why we're having trouble attracting and retaining nurses. We were a great organization before we came here. And really took it upon himself to exhibit bullying behavior and intimidating this individual who everybody else recognized walked into a terrible situation and was in the process of doing everything expected to address it. Bullies have to control. They never let you have input. And when you make decisions, bullies will change it. They will tease you. This oncologist, calling the CNA, very experienced, it's because of you that we can't keep nurses. And you're an awful person. Bullies do that. And unfortunately, in healthcare, in spite of codes of conduct and other things we have in place, we don't address it. And I even had a follow-up meeting with the president of the board over this system, and he was just silent. He was a physician, and we were talking about how inappropriate the behavior was, and that the message that sends to the whole organization. And this other physician in a leadership position, just, it was like I was talking about a sports game and somebody missed a field goal or something. And bullies like to intentionally embarrass people. Their ego is bolstered, and they get tremendous pride in trying to embarrass people, and that's a classic behavior amongst physician leaders who are successful. So what can you do? I think the first thing to do, and when I was talking to the CNE and trying to get her off the ledge because I thought it was inappropriate, is let's try to talk about what you should do. And I think you should reach out to this physician and talk about the fact that, I thought you were totally inappropriate at the medical executive committee. And I think we need to set some boundaries. If you have a problem with me, I want to hear about it. I'm open to change, but you can't talk about problems publicly where we haven't talked about them in private. And would you want me to talk publicly about you giving the wrong dose of chemotherapy last month and the harm it caused your patient? So I think it's important we discuss these boundaries, and then you've got to enforce them. The other thing, when this is going on, and it's so difficult to do, is you've got to emotionally detach. You've got to convince yourself that it's not about you, it's their problem, and don't cry, don't try to argue, don't inflame the situation. Just try to hold back, because what you've got to do is consciously realizing that they're trying to manipulate you. They're doing this to get a reaction. And in a very sick sense, they take pride if they see that they've impacted you emotionally. They take pride if they see a tear in your eye. So what you don't want to do is reward them for doing that. You've got to use what's called the gray rock method. Just act as if you're a rock and they're talking, but you don't have the ability to react to them. And I need to be honest with you, it's really difficult to deal with a bully given all the problems all of you are responsible for dealing with. So having an executive coach, talking to a therapist really is helpful in situations like that, because typically these people are so dysfunctional, you need somebody to tell you that it's not you, it's them. And as Cindy is going to talk about now, what's also key when you're in a situation like this is taking care of yourself and others, because adults, particularly adults in leadership, don't change. They might suppress their problems for a little bit, but they always reemerge.
All right. Oh, you can hear me. All right. That's kind of what you all talked about. We'll keep going.
I'm sorry. I should
All
have
right.
advanced
We're
it.
good.
Okay.
So normally this is not a topic I talk about. Normally I'm talking about surgical leadership, cost savings, things of that nature. But I'm healing. I'm healing from dealing with a dysfunctional leader from the past 2 years. And I actually was going to stop my career. I was going to say, I'm done. I can't do this anymore. I don't want to be part of this. And my daughter said to me, Mom, you have more to give. Get off the couch. You can give more. And I said, okay, fine. I'll do it. And I interviewed for this job in California, and I said, there's no way I'm leaving Chicago for California. I've lived my whole life there. I can't do it. And I did, and I took a chief administrative officer job there, and I'm loving it. And I'm dealing with a great boss. I've got a great team, and I'm able to contribute again. So in true nursing fashion, I'm up here giving, because I don't want anyone to be in my position that I was in. So there's tricks that I learned, and Jeff and I learned a lot of these things together, so we want to pass it on. And in my 40 years of being a nurse, you know, a bad job with a good boss is better than a good job with a bad boss. I've learned that. I've tried to climb that ladder. I'm still trying to climb that ladder. I don't know why, but you have to realize that it's not always worth it. And then it's again, we talked about dysfunctional leaders. The most important thing is protecting yourself. I didn't do that. I didn't protect myself. I had been there for a very long time. And one thing I learned is I have to control my future. This is my career, my legacy. No one's going to take that away from me. And I took my power back. Took it back, and I said, you're not going to tarnish what I've worked for, and I did that. I laser focused on what I could control, what was within my power, what I could influence, and that's what I focused on. And I kept saying, well, I hope it's going to get better. I hope it's going to get better. You know, after we get through this crisis, I hope things will change. Don't hope. It's not going to get better. It's not. And some of the things you can do to protect yourself is build a trusted group of people. Now, that may not be human resources. So don't look to them to be your trusted group, okay? Because that's not who they are. You could look to other colleagues that you've worked with. And I was very honest with people that I tapped into. I said, I need to know that I have 100% confidence that you're not going to share what I'm sharing with you. I need a confidant. If you can't do it, I understand. It's okay. You don't have to be there for me. But I need someone I can trust and talk to and help me. You don't need to give me decisions. I need someone to vent to, because you can't vent to below, right? You can't burden your team with what you're dealing with. You have to protect your team. So, had a few of those confidants, and then explore opportunities in your organization. Talk to different people. Hey, what's going on there? And see and just kind of fish things out. And then look outside your organization, right? There's always a lot of opportunities. And keep detailed notes. I did a really good job of keeping notes. Really helped me in the long run. Let me tell you. All the different words people said to you, timelines, things of that nature. And then build your network. One of the things I did is I tried to create 2 contacts every month. It could either be through LinkedIn, or it could be from meetings I went to, or people within my organization that I had met a long time ago, but I wanted to reconnect with them. And then build your personal brand. My brand was trust and transparency. Trust and transparency. And they all knew it, but I didn't have a brand. I didn't have words to it. So that's what I did. And prioritize self-care. You know, stepping away from work, not being on your emails constantly. Look, I was always on my phone waiting for that text to come in of, what are you doing about this? No, I was putting it away. I'm not going to do that. Set your boundaries. I'm not available 24/7, right? I'm done. Unless it's, you know, the house is on fire, I'm not going to be here for all those things. Again, document your interactions, build your support group, and avoid that confrontation. You know, I was the stone face. I wasn't get emotional because I do not have a good poker face. Anyone can tell you that. If things would get heated, I'd start moving back on my desk, moving back, because that's just how I would respond. I really avoided things. And again, we have, as nursing leaders, we have a responsibility to navigate these relationships, because we know with all our years of nursing, there are dysfunctional leaders. You know they're out there, right? You have to have interacted with them. And then protect yourself and protecting your staff. Showing empathy. We heard that earlier in our presentations. Create a safe place for them. Like I said, you don't want to air your dirty laundry down, because we have a responsibility for those leaders. We can teach them some of the tips that we've had, but don't reflect down for them. Remind them that remind your other leaders that they are not the problem, it's above. Educate on coping techniques, right? You can, rounding, we talked about rounding earlier, rounding on your team, how are they interacting, how are they coping? Develop unshakable boundaries. This is it, I'm not giving up that. And then keep a success journal, because you sometimes get so bogged down, what you feel are failures. Document your successes. Document your successes. Every Friday, I would do my email to him to say, these are all the things I accomplished this week. Send it off. Yes, I did a lot of success, even though you thought I was a failure. These are my successes. And why do we stay in these toxic relationships so long? I ask myself, why did I do that? Why didn't I have self-worth enough to get out of that? And then healing takes time, and post-traumatic stress. I mean, it takes a long time to heal, and give yourself that time. Give yourself the time and pass your wisdom on. And that's part of why I'm here. It's healing. It's healing to share your stories. And if you see others in this situation, lend a hand, pass it out. And what was my first warning signal? Think back to say, what was the first thing that I knew? Why was I in this predicament? Pay it forward again, help others, foster resilience. Resilience is my favorite, safety term. I love fostering resilience because you learn from your mistakes and you move forward. Lead by example. We hear that all the time in everything we do in leadership and safety and nursing. Lead by example. And then this is the last one I really like, because I think an eagle is a very strong symbol, and it says, when the storm is coming, all other birds seek shelter. The eagle alone avoids the storm by flying above it. So in the storm of life, may your heart soar like an eagle. So being above the rest and not letting it affect you. So.
Yeah, I think what Cindy and I have learned, and what I've learned in going and helping dysfunctional organizations is, I think you need to give it a try when you're working with a dysfunctional leader. But if that first try is not showing progress, you need to take that emotional leap to move on. Are there other places in the organization I can go, or should I look at different organization? I was working with the CMO of one of the Harvard hospitals, a double-boarded, extremely competent individual. He was the interim CEO of his hospital when the prior one left, when they were interviewing candidates for the permanent position. He had overwhelming letter of support from every single board member at his hospital. The medical staff sent a petition to the parent about the importance of him getting the job, and he did not get along with some individuals in leadership with the Harvard system, and he was devastated because he spent all of his life there, built tremendous relationships with the board, with the physicians, with the nursing staff, and eventually he just decided, I just can't stay here. It's just not fair to me and my family. So he got the presidency of a fairly large system in the country, and he's thriving. And I think, just like Cindy has reflected, she was in a terrible spot. I was close to her. I remember some of our conversations, and they're painful. And I think one of the things that I take the most pride in, and my husband, who's a physician that Cindy worked with, when David and I talk about Cindy now, because we spent a weekend with them a couple of years ago, we're incredibly happy for her. She's successful. she's happy again, she's the old person. So I think all of our jobs in nursing and healthcare leadership is to really recognize when our friends or peers are in a situation that they're going to try to work themselves out of, to be that reality check that you're working with an awful person and nobody can be successful with that person. How can I help you make a transition? Because it's not going to work. Does anybody here remember a situation where you were with a dysfunctional leader and sort of how you were feeling and coped? Yes, ma'am? It looks like the price is right. When,
yeah.
You know, the MC is, come on down.
2011 was my experience with a horrible leader. It was devastating.
What was your position at the time?
I was a director
Of nursing.
and it was not a new role. It was a new facility. It was horrible. It probably took 10 years to recover from it. However, when I saw it, which I won't give the timetable on this one, then I went to an organization to work for a short time where I saw a repeat. But I was able to identify within 30 days, I'm not staying here. So what I learned is feather your nest and watch the shit show. And then leave.
And when you then went to a new organization and you were successful, it totally built your self-esteem.
I think once you've done it once and you've seen it, the second time you don't fall trap to it because you already know that's not who you are.
Right.
And unfortunately, these people that are dysfunctional, they're really, really bad. You won't always know that from the outside when you meet them.
They always interview like they're the perfect leader.
I haven't seen this person in other settings the second time around. So I was actually shocked. And when I came there, I actually gave warning to one of my peers I was working with, and he's still director role. And I said, I wouldn't stand up for me with this individual because you're going to get targeted. Because for whatever reason, this is personal. And that individual didn't believe me. So I left and, I'm over at my new little place, Happy Little Clam. They're working for me now.
Yeah. Question, go ahead.
I'm smiling about it. So my situation, like we've all had one, was not a leader but a peer. And I just have to point out the negative power of gaslighting. You all have heard that term. So I had hired this person. They were great. They had all the skills. Some of the providers, some of our physicians are called providers. Some of the physicians just thought this person hung the moon because they were good with data. And they needed them, this person. Anyway, so this person starts gaslighting me and taking nursing staff into small rooms and having conversations, saying things about me that I had never done or said. And that's terrible. Have you ever had that happen? That takes your confidence away, tears you down. So I didn't even know any of this was going on, and then when I found out, it was HR that was contacting me to let me know. But anyway, gaslighting. They make you think you're crazy. Mm-hmm. They say things that you don't say, or they twist things that you do say, and there's never a win. So to your point, I finally figured out, and I did get HR's help. They knew what was going on, and I know, but they did help me. And I don't know where I was going with that, but I did stick it out because I kind of dug my heels in and said, I didn't do anything wrong. I'm not the problem. This person is. And she eventually dug her hole and she left. But the bad news, and I had to go through therapy.
Right.
I got to go through therapy. I used therapy to help. But the bad news in this story, my organization, she left, And about 2 years later, my organization hired her back
Oh, yeah.
in another center, another unit. And she didn't last a year, and she was gone. So
Right. It's
gaslighting
it's-
is terrible.
Yeah, it's
Woo.
much easier to cope with dysfunctional behavior of a subordinate because you do, have some role, but it's damaging. It's damaging. Ma'am?
So I don't have much of an experience, but just to kind of come off what you were saying with that person, well, that person was rehired back. So in our organization, we hold reflective practice meetings and sessions with leadership groups, more focused on nursing, about how to deal with challenging situations and proper communication and stuff like that. So we give the nurses the tools to deal with these challenging scenarios where physicians are bullying them and stuff like that. But I just feel like they come up with so many scenarios of, and I know who they're talking about because this person does it all the time, but then I feel like we're not really addressing the issue, like why are they still allowed to continue to behave that way, and we're accepting it, we're trying to change ourselves to deal with that when they're the ones who should be punished. And I don't know if you have any thoughts on that, but I always struggle with that because there's particular people in our organization, same culprits, continue to do it, and we're trying to fix it on the nursing side, but it's not really nursing to fix.
It takes courage, and you have to have a physician leader who has the courage to do that, or a chief nurse, or someone who's going to sit down with that physician and address it. And I have, in surgery, my whole career, I've had a lot of times where I've had to do that with them and say, do you understand? This behavior causes this. One day, this nurse is not going to give you information about your patient, and there's going to be something missing, and you're going to be holding that bag because, you know what, you've treated them poorly for so much. So please, I'm not saying you have to be their friend. I'm not saying you have to be super nice. Just be cordial. And I've had those crucial conversations. It's extremely hard, and I know I'm like shaking and like this when I'm having them because you don't know how they're going to react, but you have to do them. And it takes courage, and it's hard, but it's part of leadership. And that's the challenge. But you have to do them. You have to.
Yeah. Yeah, I think if you're going to be effective nurse or healthcare leader, you've got to build coalitions. And the most important coalition is the medical staff because they ultimately control the revenue of what's coming in to the hospital. And then the second coalition that's important is the executive leadership. And today, more and more CEOs of systems are physicians, so they have an appreciation. But that's really critical in surviving any of these situations, is to build a coalition that can force that individual out and protect you. But this idea of coalitions is just crucial. And I was on the phone all last night where the CEO of this hospital in a system was undermining a director of nursing who uncovered Medicare fraud that was blatant and was going on for at least a decade. And rather than listening to the CNE who, had gone through the charts and, looked at the billing and realized that there were some physicians committing Medicare fraud, the CEO of the hospital was defending it. And the only way, and what we were talking about, because she felt badly, is, well, let's talk about the coalitions of who can help you. And luckily, she built a coalition with the chief medical officer, who I thought was grounded and ethical, and the chief legal officer. And between last night and this morning, there was a different personality transformation because she had built that coalition. And when she got into work this morning, the chief medical officer and the chief legal officer were waiting for her in her office and just wanted to tell her that she was doing the right thing and they supported her. So let's talk about how we're going to address this. But coalitions are really important.
I just wanted to make a point real quick about therapy or coaching or counseling.
Oh, I'm a big fan of therapy, boy.
And you mentioned that these people usually interview beautifully. They do not.
Really?
Yes, they will show you their red flags. And thinking back to the interview that I participated in for my role now, there were so many red flags that I didn't recognize, but I will the next position. So if any of you have dealt with any of these leaders, get some sort of coaching, counseling, therapy so you can recognize those things in the future and learn how to deal with them. Even in the interview, they will show you.
Yeah, and the other thing is therapists spend the majority of their day with people with personality disorders or dealing with them, so they have a lot of good feedback for you. Mostly, it's not you, it's them.
I just wanted to kind of piggyback on what you said, ma'am. I had a very similar experience to you where it was actually my first nursing job, first nurse manager or leader, directly after passing boards, who was a bully, for lack of a better term. And I didn't know any better, and so I decided to challenge it with admin. And to nobody's surprise, that did not work out well for me. So I actually very seriously considered leaving nursing altogether.
Sure.
And I know of other nurses who have been through similar situations who actually did leave nursing, which is unfortunate. I've spent most of my postgraduate education and research on new graduate support, and coping mechanisms and things that we can do to just kind of help them navigate this process from being a new graduate nurse to like a seasoned nurse. And I think this presentation would be very helpful for like people in nurse residency throughout your organizations, or even to local nursing schools, just to have like a guest presentation to kind of discuss this.
Sure.
So my question was, do you offer this education in your institutions through nurse residency, or even through like regular hospital education and throughout nursing schools? And if you don't, why not?
So I do, well, I did when I was in Chicago. I taught a peri-op nursing course when I was at Oak Point. And I did perioperative nursing, and we talked about surgeons, and we talked about anesthesia and how to respond, and the hierarchy, and how to do it, and how to deal with it, and all those kind of things. I was very, like trust and transparency, I let them have it. This is how it is, and I explained to them some of the stresses they have on and why their responses, and how you respond, and how you need to be a diffuser, not an igniter, and all those things. And I think it's important to do that. I don't think they're doing that, but I did in my peri-op class, because I think it's important.
Hi, thank you. My situation's a little different. Early on in my career, when I took my first position in academia, I was a clinical...
Which is a tough environment.
Very tough environment, and I'm junior faculty, and I had just received a $20,000 grant for my research. And I was ecstatic, and I was walking down the hall, and my department chair, who was everything that was on that list,
And more.
screaming at me that how could somebody like me get a $20,000 grant, and she was going on and on and on and on. And the thing I learned at that point was, to your point, you need backup singers. And as I stood there and made my own case quietly and forcefully, my two backup singers, Dr. Sarah Archer on my left and Dr. Afaf Melis on my right, they just walked out of their offices and stood behind me. They're senior faculty. Because if you don't have your backup singers, you don't have that support, and it is a power play. They were more powerful, frankly, as senior faculty in an academic setting, members of the academic senate, more powerful than the director of the program, the chair of the department. So pick and choose the right people. But what I learned is you have to learn how to stand your ground. You have to be confident enough in who you are to say, hey, something's wrong with you.
Yeah.
I did what I was supposed to do. That's what my role is. So backup singers, you're absolutely right. And learning how, know that you're going to find one. They're going to be in your life, so start practicing now. How are you going to deal with it when that person presents? You need to prepare yourself because they're everywhere.
Yeah,
Thank you.
and I think what I've found, particularly in hospitals, which I find to be heavily hierarchical, and particularly academic medical centers, the ultimate successful people are not dysfunctional leaders. You know, the ones that have achieved national recognition, they're not the dysfunctional leaders. Part of dysfunctional leadership is this internal feeling of failure on their part, and rather than addressing it by dealing with it, they're trying to make others feel terrible. So we have a red light flashing, and I want to be a good steward and pay attention to time. But I think I can speak on behalf of Cindy and I. This was really a pleasure to have the opportunity to sort of have closure to an experience we both went through. So thank you very much for tolerating us.
We're going to have one more question. One more question and then.
And I was
we'll-
trying to be so well behaved. Okay, bye.
You got someone from Springfield.
Make it real quick.
It's only because he's from Illinois. Yeah.
So, in addition to being an instructor, I am also a nurse practitioner in psychiatry. And what I found out about bullies is that bullies live in a silo. Everything that's been, they don't receive information. When you complain about what they're doing, you try to redirect them, they don't get it. They don't understand these things. They just kind of bounce everything off. So, and the truth is that bullies sometimes are progressively created. Over time, environment just kind of changes them to the point that they become bullies. Now, and every time I see people talking about bullies, they talk about, them. And I keep wondering, where are those bullies? Because, they're amongst us. Sometimes we don't know that we are the bullies because we're living in that silo. We're not able to receive information from outside, so we think, I've seen bullies complaining about bullies. So how do we prevent ourselves from becoming that bully and not understanding that we had turned to the bullies?
Well, I think one of the things we talked about earlier was seek to understand. So if you're seeking to understand why someone is acting that way, you are not going to be that bully. And I think the rounding and self-awareness, the emotional intelligence, all those things, I think it prevents you from being a bully. I'm also a big reflector. So every day when I get home, I reflect on the day. What went well? What could I have done differently? And I think that helps, because if you watch the way people respond to you and react to you, that helps you realize that you're not a bully, or that went really well, or wow, Jeff and I did not hit it off yesterday. I'm going to circle back with him in the morning and say, hey, Jeff, let's go for coffee. I didn't feel well yesterday about our interaction, right? So you have to be aware of how you are perceived by people. We also talked about, as a leader, you're always on stage. People are always watching you. So those are the things that I do to make sure that I am not perceived as a bully or an ineffective leader.
Thank you.
Thank you.
Thanks.
Oh, thank you very much.
Thank you so much.
Oh, wow.
Yeah.